Mr. Hanley is a 67-year-old diabetic male who is on dialysis, meaning his kidneys aren't functioning optimally, so he needs some assistance filtering his kidneys. And he also had severe circulatory disorders, meaning inadequate blood flow to extremities. And he also had neuropathy, which is numbness and tingling, so he has no feeling in his feet.
I thought I twisted my ankle and I actually broke my heel and didn't know it. Walked on it for a couple of weeks and it really got bad. I was getting sores on the outside of the heel and on the left foot.
He had a calcaneal fracture, which is a fracture in the heel bone that never healed, and that led to a open wound. Having this wound for a prolonged period of time with poor circulation led to his heel bone being infected.
They had actually gotten gangrene in it. So I went to a vascular surgeon and they said that they had to amputate the leg above the knee. And I got two other opinions and the same thing was always said.
I think this is the worst case scenario when you're diabetic. Once you amputate a limb, you increase the cardiovascular load, meaning the stress on the heart. Also, within 5 years, there is a risk of having that contralateral or other limb amputated because, again, of that pressure and that stress or that load put on that other extremity.
Tell me how you felt, your emotional state when you were dealing with the possibility of the leg being amputated.
Getting depressed more so than anything. And by the third opinion I got that was the same about cutting the leg off, I was just about resolved to do it.
Did you ever see a case like Mr. Hanley's before?
Not as aggressive an infection in the heel, but Mr. Hanley's unique in the fact that everybody he saw was recommending amputation.
So you had neuropathy too?
Right, I had neuropathy.
How did the neuropathy affect your feet?
You have no feeling in it. And sometimes you get pain from like burning and pins feel like sticking in the leg, in the foot and all.
And were you treated separately for the neuropathy?
Yes, but there's not much they can do. It's been too long.
When we talk about neuropathy, it's most commonly associated with diabetics. And usually the early signs of diabetes, even if someone's that's not diagnosed, is numbness and tingling in the feet. And when they're numb, you can step on something, or in Mr. Hanley's case, he had this open fracture of his heel that he didn't have any pain with, he didn't associate anything with, so it lingered a little bit. And when he realized that there was an infection down there, the bone was infected already.
Well, I was about ready to get the leg amputated when a friend of mine heard Dr. Teichman's advertisement on Bobby Gunther Walsh, and also we saw it on a placemat in a diner. So I said, well, we'll try it one more time and see what happens.
Everybody who saw Mr. Hanley wanted to amputate the limb. And coming to see me, amputation was not an option at that point in time because I didn't think that we have exhausted all our other options.
Was this the fourth or fifth practice you came to?
Fourth.
Wow.
I just didn't want to give up.
That a wound will not heal when the bone is infected. And he was not a candidate for long-term IV antibiotics. So the only option was to go ahead and take part of the calcaneus out of the heel without leaving an open wound. If the infection progresses in the leg, it can lead to someone getting an infection in the blood, which we call septic. Then that can be a life-threatening condition. And if there's no blood flow going to the leg, there's no way for the body to fight the infection. And
Dr. Teichman is the one who told me, he says he could save the leg if I could get blood flow down there.
I recommended that he go see an interventional cardiologist who we work very closely with in our limb salvage program. And I referred him to Dr. Mangle-Murdy, who went on to restore his blood flow, so meaning that he went ahead and opened up some of these vessels very aggressively. So once he restored that blood flow by opening up those vessels through interventional radiology, he allowed me to go ahead and do the definitive procedure where we can eradicate the infection in the heel. I didn't want to have an open wound if I could avoid it, because it also increases the risk of infection as well, because he didn't have the best circulation, but we did restore some blood flow. So once I took the bone out of the heel and I tried to close the wound, I found that I was able to move enough skin over the wound to get it to close. But my thought was that since there was such a big hole in his heel, that I wasn't going to be able to close this wound during the time of the operation. After we completed the surgery and I saw Mr. Hanley for the first time in the hospital, I was really excited to give him the great news that we did take the bone out and we were able to close his wound. And after that, I was very optimistic in that we're going to have a very successful outcome. And he was so grateful to hear that news, that we were going to possibly save his limb, and that amputation was a lower percentage at that point in time.
Yeah, and I was off my feet for another 2 or 3 months while it healed. Then I started walking. First, just putting weight on my foot, and slowly but surely in rehab, I was walking.
To this day, he's healed without any signs of infection or pain or issues with that infected heel that he had to deal with for many months. And it's not every day that a patient doesn't want to give up, and he didn't want to give up. He wanted to fight to save his leg. And that's what our job is, to fight to save a patient's leg and do everything we can in our power to prevent this amputation. He is so ecstatic when he comes in the office now to see us, and he can't stop talking about how we saved his leg. And it makes me feel very proud to basically be a part of that. And he's also impacted my life. It's shown me that what I can do as a physician and surgeon as well. And I consider Mr. Hanley now a friend of mine and a friend of my practice because of what we went through together.
So he's done an excellent job. And I'd recommend anybody, before you decide to get a limb cut off, check with him.